Okay.
So go ahead and introduce yourself.
So, I'm Angela. I live in Wisconsin and I work as a radiographer at our local hospital, Gunderson Health Systems
And what city are you in?
in La Crosse, Wisconsin.
Give us a feel. Wisconsin's been pretty heavily in the news in terms of the patients that we're hearing about. I also have family in Wisconsin, and I've heard about like really an acute shortage of beds. So what's the view of it from where you stand as somebody who's working there and is also a mother there? What's it looking like for you?
Yeah, so it's been challenging in some ways. I know on average we have a lot of healthcare workers out due to COVID, either being tested positive themselves or having to care for family members that are sick, or I think home with children. All of our schools are virtual at this point, so it's added a lot of stress that way. And so we're working short-staffed a lot, so that's a little bit of a challenge. But our beds, we initially started with one COVID unit, like an entire wing where they did a negative pressure wing, and it has increased. We have like 3 or 4 units now, so it's definitely tapping a lot of our resources when it comes to that. But
when you say a unit, does that mean how many rooms are in a unit, or how many patients are in a unit?
Sure, it varies a little bit. One of our units can house 28 patients. One of our units can house 20, so it varies, unit to unit and what that wing had available for beds. But we have over 70 beds available now for patients, and some days they're full. And that's in just one of our hospitals. We have another hospital here in my town, and they have affiliate hospitals that are close by that I think majority of their higher risk patients go to that hospital setting for care. So our numbers have been growing a lot in our area, based off of how big our population is and how many numbers we have. It's getting bad. I think a lot of it is people just really feeling that itch and that antsiness to be out and about, and they're getting sick of being indoors and being away from family, and we all feel it, but it's getting harder to see that as we see the numbers spreading and the cases that are happening. We're getting more severe cases that need that hospitalization and that extra treatment. So
okay, and I saw that Wisconsin's numbers went down a little bit, maybe in the past, like around Thanksgiving, and there's also suspicion that that's because testing stopped for a couple of days around the holidays. What's your take on that?
Well, I wasn't necessarily aware that the testing had stopped. I'm sure maybe a few people didn't go do testing, but I know that our local university, the UW-Wisconsin, had told a lot of their students that if they were going to be traveling to go home for Thanksgiving break, that they needed to self-isolate for the 2 weeks prior to going and switch to virtual schooling if they were in an in-class setting. And then after the break, they will be doing 100% virtual for their students. They won't be bringing them back onto campus. So they're doing that part to try to help reduce the spread. Our local technical college has been virtual since March. So they're not, except for certain fields like welding, you can't do virtual. So then, they are allowing certain things like that to still be in face-to-face. But as a whole, our schools are trying to do what they can to help reduce the spread. I think that it's just being safe and reducing the travel is best. We have a lot of really cool options like Zoom, and I've heard of several people using that as an option to see family, and it actually, I think, helps connect more family. So a good resource.
Yeah, I'm
to
curious.
utilize.
I'm curious about how much buy-in you're getting for that. I was struck when visiting Wisconsin to see a dying relative this summer. It wasn't the best of circumstances to travel, but kind of, we won't be making it back for the holidays. But I was struck by kind of the tension and kind of like some people were into the mask, and then this other group wasn't, and there was like a palpable tension. And then I've also been watching from afar that maybe Governor Evers will pass something, and then maybe the Tavern Association or somebody else has a lawsuit. And so where do you think the state is as a whole with kind of accepting that COVID is a real thing and it's impacting lives? And where are people with balancing their personal rights versus caring for the state as a whole?
The bigger, yeah, it's always a rough topic. I have some very strong opinionated friends who I think are mainly anti-maskers, do what they need to do when they have to do it, but are a little bullheaded when it comes to loopholes that they can get around, so to speak. But it's a tough subject to talk about. A lot of people don't either fully understand it, like the behind of it. Maybe they don't, it's from not working in healthcare, they don't see what it's like. They don't see like the extra strain that it does put in the healthcare system. But I actually just had 2 conversations yesterday with 2 people that were very strong opinionated about like what they should and shouldn't have to do. So it was kind of.
How do you navigate those conversations?
I try to respect their individuality and kind of to each their own. It's definitely, I practice social distancing already, but like one of those people are my brother. So you would think hopefully I would be able to see him at one point during any of this, but he's pretty stubborn about his opinions, so we just don't hang out. We talk over the phone and things like that. So it's just I try to re-educate where I can in the stuff that I do know, but also try not to diminish my relationships with people. It gets to be tough, and sometimes I think it's they have to make those choices on their own. I can only do as much as I can.
Yeah, I'm so happy that you are willing to share that, because I think a lot of people could connect with this probably across the country, where there's even differing perspectives within a family, but for you, between you and a sibling. And
Yeah.
so you're hearing this and you're wanting to respect this person's perspective, and yet you're working in the medical field and you're seeing the magnitude of this. Yeah, how do you kind of reconcile that, or how receptive have any of these people been to hearing like the things that you're observing? I'm curious.
Yeah, I think a lot of times people kind of have their mind made up about a subject, so you do have to tread lightly in it. Like I said, I just try to educate with what I can, and circle back around to it here and there. So if there's like a topic being discussed about, well, so for example, my brother is a bartender of all things too. He does bartending. So he's in a high risk area for his job field. And he really likes statistics and numbers. That's his thing. So having a conversation with him is a little more challenging because he does a lot of the research, but I don't always think necessarily in the right spot. So he forms his opinions, and that's okay. And I kind of let him say his spiel, and then I just occasionally put in like the medical part of it that I know, and just hope that eventually those seeds will plant and get somewhere. But yeah, so it's interesting. It makes for interesting conversations.
I can only imagine. I mean, and I'm glad you brought up the part about him being a bartender, because that is an irony, right? Well, in the Stevens Point area, I know of a teacher who's like, teachers are working full time there, and
Yeah.
people are popping up every day who are COVID or they've been exposed directly. And then where you are, it sounds like it's virtual, but across the state, bars are open.
Oh yeah.
So how do you kind of, what's your take on that piece of it?
It's difficult. I mean, so La Crosse is considered college town. We have 2 universities and the technical college here, which for a population of 50 to 60,000 that's a lot of school for majority of our population in general does come from college kids. So a big population that likes to go down to the bars. And it's hard. I think we see a large increase in numbers in that age range due to the community spread from the bars. And it's just a situation that is hard to control or navigate proper social distancing. As anybody knows, once you start having a few drinks, you tend to not care so much about keeping your mask on, or, maybe not being too close to people. So I think that it's nice that we can get our local businesses supported, but I also think that it just adds a lot to the risk. So it's finding that happy balance, and I don't exactly know where that is yet, but I guess we'll continue to see where it goes.
That makes sense. I'm gonna have one more question for for you here, and then I have one kind of personal question about navigating the multiple roles that you navigate as a parent and a medical practitioner. But first of all, nobody's on the other side right now to argue with you. You have completely the floor. So as somebody who is doing this work on the daily, maybe not directly, but in the same vicinity, what is your message for people? If you could have their ear, like what kind of compelling argument would you give to people about maybe the people who are dying to see their family in person, and they're tired of the mitigation, and they're tired of social distancing and masking? What would you say? The floor is yours. No one can argue with you.
I guess the biggest thing that I would say or stress is that, if you have had a contact or you've had direction to isolate, to take it, because the longer we fight it, the longer this is going to continue. So if you want to be able to visit family and friends and you want things to go back to normal, we have to get a handle on it. And the best way to do that is to follow the recommended guidelines. They say that you're contagious for 10 days. As long as your symptoms start to fade away after, or are gone after those 10 days, then you're not contagious anymore. But the last day of contact, so like if a husband becomes positive, then the wife's last day of contact was his day 10. She is then supposed to isolate, quarantine for 2 weeks. Follow those guidelines. Yeah, it's a hard month to be out and not being able to do things. But if you're out there and you spread it, then now you're talking multiple families that are affected over just, an inconvenience for one. So, the sacrificing of one household's wants or needs for the greater good of the community is, I think, important in these times to help reduce the spread. We have a big thing down here in La Crosse. We do the Rotary Lights that they start the day after Thanksgiving and they go through New Year's Eve. And, that's going to be really hard for people to not want to go to, but I guess my recommendation would be, if you are under an isolation and you still want to see them, don't get out of your car. You know, don't roll down the windows, go drive through it, but stay in your car. Don't get out and mingle and risk that exposure to all the other people that are around. I feel like there's just so many things you can do that doesn't require you actually being face to face in it, that you can still get a benefit from what it is that's out there.
Yeah, thank you. I really appreciate that example. And I just kind of, you know, I have roots in that area, so I watch different Facebook posts. And one recently, I saw somebody write a post like, "F COVID, my grandma
Yeah.
is dead," and then the next day it was like, "F Tony Evers, because now the Madison tree lights aren't going to be lit up, and how dare he take that away." So I don't know, like the tension, the post was by the same person. And so I'm feeling like maybe people might have a blind spot to, yeah. I mean, are you seeing this as well?
A little bit. And even myself, I mean, I can't deny, like, I have my days where I'm just like, I'm so over this and I want to do something. And then I have my days where I'm like, whoa, let's back the train up. Like, this is like way more serious than I, maybe thought it was. So, but it's mostly just those days that, it's a nice sunny day out and you want to go do something, you want to call your friend and go for a hike. And it's like, okay, maybe that's not so bad to have a friend, you're out hiking, remember to practice still social distancing. So, if it's not somebody you live with, you shouldn't be congregating in close group activities. But I definitely feel that, I see that. I personally feel it, like I said, I have my days where I'm like, I want to go do this, I want to go do that. And I guess I would say, if you choose to participate in a risky activity, then be cognizant of how it will affect other things. Like, for example, if you go to a large group gathering or even to a gathering with people and you live in a house with other people, and wear a mask. I mean, wear a mask when you get home. There's nothing that stops you from doing it. If you're in your own bedroom and nobody else is in there, go ahead, take it off. But if you're going to be out in the common living areas, mask up. That's how it reduces your spread of it to other people. And wash your hands. It's a big thing. Wash your hands, use rubbing alcohol, like Isogel, hand sanitizer. So
yeah. And sometimes we've heard lawmakers across the country say things like, well, if you choose to have like I heard this one a lot, at least in California, if you choose to have a big gathering for Thanksgiving, you can plan on attending a funeral and around Christmas time. And there's and some people say that's an exaggeration. But what about you? What's your take on this? How much?
Yeah, I think it will be interesting to see what the numbers do bring. I know that there are a lot of people that carry more just mild symptoms or are even asymptomatic and test positive. And it is hard to justify like why I would have to completely change my life when I'm not the one that's going to be highly affected by it. Probably. Who knows? I might have some underlying condition that just has never flared up for myself before. And if I get it, maybe it won't be a great outcome, but I also have my 85-year-old grandmother that lives with me that I take care of, and she probably wouldn't survive it if she gets it. We like to think that, okay, my grandma grew up on a farm and she probably ate dirt and she's probably immune to everything, but the reality of it is that she probably wouldn't survive getting COVID, and so, yeah, we didn't do a mass Thanksgiving gathering. It was me, her, and my daughter. And so we just kept it simple and low key. And I think that sometimes we're getting to that point where we almost feel like we have to really show the drastic side of it, because there's so many people that want to be non-compliant with the recommendations that, you know, you have to almost bring that reality and that truth forward. I mean, it's an unfortunate thing to have to do that, but they've done things similar in the past with other things. I don't know if you're familiar with the Stop the Bleed campaign, but
Tell me about it.
yeah, so the Stop the Bleed campaign was really geared towards teaching people safety measures on, like, if you see somebody that is wounded and they're bleeding, like how to help control that bleed so that they don't pass. And you know, it was after certain large events that had happened, like mass shootings or things like that, where there was multiple people injured and they needed like citizens that were on the ground in there, that they're the first responders. They're the ones that are right there next to the person. So the campaign launched to try to put Stop the Bleed kits in like random public areas that maybe could be beneficial. But some of the postings that they used were very graphically on target. You know, even I think one of them even showed that, you know, almost like a progressive picture of a little girl who, you know, if one person would have stopped and held pressure on her leg, like she would have lived, but she didn't. And it was represented in the photos. So, you know, sometimes having to give that whole picture is what brings it into perspective if the sugar-coated versions aren't working. So,
and for this, I think that's a powerful analogy to make, and it really kind of speaks to even like the bystander mentality, right? You see somebody being harming somebody in the street, you say something, right? And so for this, we're not even asking people to do much. It's a matter of follow the CDC guidelines, right?
Yep.
I appreciate that example a lot. Did I understand, are you a single mother and also taking care of your grandma?
Yeah. Yeah.
So the last question for you then, like a personal question. So you are, you know, you've got a multi-generational household and you're taking care of a little person and an elderly person as a granddaughter. What are your worries every day as you're working where you work and trying to keep your family healthy and trying to make sure that you're there for your grandma and your daughter?
Yeah. You know, I always worry if I'm picking up something at work, am I bringing it home? You know, if I'm going to the supermarket to grab food to feed them, am I bringing stuff home? You know, and balancing out how to, like, my grandmother has an aphasia. So she suffered from a stroke a few years ago, and it limited her communication. And I just don't think that she fully comprehends what the virus is. So trying to explain it and tell her why she can't go to the grocery store with me, or, you know, just those types of things, she doesn't get it. So I am in constant like worry of what am I bringing to her. And being a single mom, my daughter does travel between households, so that gets a little scary too. Like, what's the other household got going on? Are they practicing the same guidelines that I'm trying to practice? So it gets to be a little challenging on days, but do the best that I can do. We wash our hands anytime we have been outside. So if we go to the grocery store, we wash our hands as soon as we get home. I also have like hand wipes in the car that we just at least do a quick wipe down when we get into the car if we have to go to the grocery store. Being a single mom, sometimes I don't have a choice but to take my kid with me to the grocery store. And the shifts that I work 3 to 11 p.m. and around here, everything except for Quick Trip is closed by 10. So I'm doing my daughter's in kindergarten this year. My son is a sophomore in high school, and during the day from 7 to 2, I'm schooling, and then I work 3 to 11. So And the days that I don't work, those are the days I get to go shopping, and I have my kids, so sometimes they gotta go with. But we just,
Oh, go ahead, keep going.
we just practice being as safe as we can. You know, I've really talked to my daughter about, you know, you can't just touch everything on the shelf. You can't take your mask down. You know, we have to wash our hands before we do anything, and just really being careful about, you know, what she does with her hands after being somewhere in public. Stay away from people in the store. You know, if there's 20 people in an aisle, we go down a different aisle and come back. So just those things.
Yeah, I'm also with you in the fact of being a single mom and not having family here at all. So my children, of course, mask up and come to the stores. But I was going to say, for those who don't know, Wisconsin, Quick Trip is a thing, and they've got everything there, right? So it can be your shopping stop. But I noticed even there, if you visit a Quick Trip, you can notice really people who care about the masking policy versus those who don't care so much.
Sorry.
No problem.
My grandma just got home from dialysis, and my daughter and her are talking about something in the other room.
Right. Well, that's totally fine. I understand this is COVID times, and we've all adjusted to a new norm. But
Right.
I was just thinking about how convenient it is for usually probably for a single mom to have access to a Quick Trip, and also how that's kind of an epicenter of all the different perspectives you can see. At least that's what it was like this summer. You could totally see where people even felt politically versus about what their views were almost by whether or not they chose to wear a mask. Has it shifted? Are more people willingly complying, do you think?
You know, I'd say for the most part, especially the like chain stores, I see a lot more compliance. Sometimes the smaller shops, or I guess I don't know how to describe them. I see a few areas where, you know, if you're going by or you walk into briefly, that there's maybe a little less compliance, but I also think that it has to do with there's just not as many people, and so then they feel well, if nobody's in here, then it's okay to not have my mask on. And in general, just people still just really are. I guess I see it both ways. I do. I see it both ways now, where there's still some people that are very stuck in like, nope, I'm not going to wear it, and that's my right, I don't have to. And other people that are just like, you know what, I'm just going to put it on to go into the store. So it's not a big deal, and then I'll take it off. And yeah, we are very lucky that we have a Quick Trip, because it does have almost everything. I don't know the last time you've been back, but
July.
they have, okay. They have like a whole meat section now. You can buy chicken, steak, like I can go grocery shopping at Quick Trip if I needed to. And actually my hospital has also opened like a small pantry for us, so we can buy at least essential items like milk, bread, eggs. I haven't utilized it like I probably should. I keep meaning to go check it out, but by the time I get done with my shift, I just am ready to go home. So, but you know, that's been a really big perk. You know, I feel very rewarded that our system has done that for us, because like I said, like for me, when I get off of work, everything's closed. And so if I needed milk for cereal in the morning or whatever, you know, I can't go buy it unless I go to a Quick Trip, which is a good option. But so it's just nice though that they offered that opportunity for us.
And lastly, almost lastly, so if this vaccine comes out, will you be taking it and sharing it, or where are you standing on that issue?
I mean, I'll do a little bit of my own research. I like to be educated in anything before I do it. I would like to think that I would be willing to give it a shot. I'll have to weigh the pros and cons of it, obviously. And just know like where it puts my family. So I know sometimes vaccines are like a live vaccine. And so I would just really look into it and see if, okay, if I get this vaccine, am I going to have to kind of self-isolate from my family for a little bit just to see how it affects or whatnot. But I would say that I'd be an advocate for it. I've seen a lot of really beneficial things from vaccines. And I know that a lot of people are concerned that it's rushed and, you know, it's out there and little off topic, but a lot of people I've heard say like, well, I don't think I'm going to get the flu shot this year because they spent all this time and money investing in the COVID vaccine. What work have they done in the influenza vaccine? And they start making the influenza vaccine the year before they release it. So I would say it's still pretty safe to get that vaccine if you know you are somebody who is normally who gets it and wants to continue getting it. I would highly encourage it because I'd say every day is one of those gambles where it's like, is it influenza? Is it COVID? Is it just a cold? Is it allergy is spiking back up? You know, we're all playing that gamble almost every day. So get the vaccines that are there. I think the COVID vaccine is something that I would do. I just would have to read on it a little bit more before I say a full yes.
That makes sense, and I think that's great. Everybody should do the research on that. I mean, that seems like fair advice. And
yes,
yeah, and I think you've talked about the importance of following guidelines, and you've given us a snapshot of Wisconsin and even like a view of you as a single mom and a healthcare practitioner. Is there anything else you wanted to add before we conclude?
No, I think that I've said a lot, and I guess if I were to add something, it would just be to, you know, just push through just a little bit longer. And, you know, every day we are learning a lot more and gaining more information, and that's what is going to help us beat this. So if you can just push through a little longer, then we'll come out of it on the other side better and faster. So,
and by push through, you mean comply, wear a mask, social distance.
Yeah, I guess in a nutshell, yeah, you know, just do the recommendations and be safe and just help protect the people around you that that can't handle getting it, can't handle catching it. You know, I don't wear a mask to protect myself. I wear a mask to protect, you know, the person that's going through chemotherapy, or I wear the mask to protect my grandmother who she can't, you know, she wouldn't be able to handle getting it. Or, you know, I wear a mask to protect the 8-year-old that has a compromised immune system, that if I give it to his mom, now he has nobody to care for him, or he gets it and it's not okay. So I don't wear the mask to protect myself. I wear the mask to protect everybody else. And, you know, it makes me feel better when I see other people extending that courtesy as well.
That was very articulate, very articulate. I super appreciate it. Thanks for taking the time to talk with me.
Yeah, thank you.